probably the next great advance in medicine will be putting together the mind and the body. And it's been happening for many years in some places, but in Western medicine, we haven't been so good at it. To help us get through this, to see this connection between the mind and the body, we have with us an expert, Dr. Steven Hickman. Welcome.
Thank you.
Dr. Hickman is an assistant clinical professor at the University of California, San Diego, and is director of the recently begun Center for Mindfulness here at UCSD. I talked about mind and body. In some parts of the world, that idea is thousands of years old, yet in modern Western medicine in the United States, that idea seems not yet to have taken hold.
Yeah, it was funny as you were saying putting together the mind and the body. I was thinking that really they were never apart.
Well, that's why you're here, right? Help us out with this. What happened that somehow they became apart?
Well, I'm not really well versed in the history of medicine and psychiatry and things of that nature, but obviously at some point there was Descartes who sort of divided the two and said that the mind was something separate from the body, and I'm not really up on all of the details of that, but Western medicine sort of took off with that and kept that idea alive, that what was happening in the brain or in the mind was something separate from the body.
I remember in medical school hearing things like, oh, it's all in the patient's mind, you know. I went to Yale for medical school, and a lot of work there was done with mind-body after surgery, showing people comedy films or trying to connect into that. And everybody looked askance at the doctors doing that kind of research, that it was somehow not really medicine or it was offbeat. How do you get past that idea that affecting the mind or using the mind to affect the body can work?
Sometimes I'll use a very simple example. I work a lot with chronic pain patients, for example, and they're referred to me by their doctors who are anesthesiologists, and they're asking me to help with this patient. And the patient is often there under the impression, although it wasn't given to them by the doctor, that there's something, the pain is in their head or whatever. And I'll talk with them about the connection between the mind and the body by using a really simple exercise. I'll say, take a moment to imagine a lemon, just the brightest, freshest lemon you can imagine. And then imagine cutting a wedge of that lemon and holding it up to your eyes and squeezing it into your mouth. And ask them what they notice. And 100 times out of 100, they notice salivation. And I said, okay, so something happened in your body, a chemical reaction, a whole sequence of events happened as a result of something that didn't even touch your body. There wasn't even in existence a moment ago, and it only existed in your mind, and yet it affected your body. And so there's just a very simple connection between the two that we take for granted every day.
It's an obvious connection that we take for granted, yet most people do. I think medicine is probably turning a little bit and making this reconnecting and understanding it. I was impressed by the fact that you are working with and trying to deal with pain as one of the things that you do most with, because I think at first glance people would have said there were other symptoms or problems that they would have expected you to be dealing with rather than chronic pain. I think most people think pain means you get a pill or an injection. How do you help people with chronic pain by using your techniques, and why do they end up in your hands after the anesthesiologist?
They end up in my hands as we work as a multidisciplinary team, which is a part of this whole bringing back together the mind and the body, that everyone realizes that one particular aspect of treatment is not good unless you're treating the person from all sides, and that's what I'll tell patients. So we're routinely involved in the care of patients that come with chronic pain, and it's very simple with patients with chronic pain for me to say, you know, pain is complex. And it's not a simple thing, and it's not just, you know, I cut my finger and so I have pain. Especially with chronic pain, they understand that there's an emotional component to it. Not that it's created necessarily by the emotions or imagined in any way. And often what I'll say is that the doctors hate to ask this question, you know, what's your pain on a 1 to 10 scale? And it's become very routine that we have to ask that. Patients don't like it, because it's so subjective and they don't know how to pick the number. And if you've ever been asked, I know when I've been asked, I've been annoyed. doctors don't like to ask it, but there's no blood test, there's no other way to measure pain. What else are you going to do? And I'll say that I actually like that question, and I like it because a person could say anything. They could say, as I sometimes get, oh, I'm a 12 on the 1 to 10 scale. And that's when usually the doctors are rolling their eyes and the patient is annoyed. And I actually get it, because I'll say that that 12 is actually made up of 2 components, sensation and distress. The sensation is very simply just that you feel, the actual nerve impulses going to your brain saying pain, stabbing, twisting, whatever sort of pain. The distress is the part that you layer on top of that. So the fear, what is this happening to me? How long is this going to last? Is it ever going to stop? Is this going to affect my relationships? All of those sorts of things. And distress is my business. So I'll say to this person, I can do some things that can help you with sensation, relaxation techniques and things like that, but distress is the big piece, and we can deal with that. And so if you have a 6 of sensation and a 6 of distress, you can have a 12 on the 1 to 10 scale.
Absolutely. I have chronic back problems, and had a horrible pain a few years ago that was unrelenting and was scheduled for surgery. And my problem with the pain, I remember turning to my wife saying, if I knew it was going to stop and I just had to get through another day or 2, or it would be, I could deal with that if I knew when it was going to end. Mm-hmm. But when you don't know when it's going to end, I understand that distress concept. I mean, knock on wood, for me it worked out, and I think the threat of surgery helped get me past everything that was going on. But that was just my little touch of it, and I can't imagine someone living with that chronic pain and not knowing it was ever going to go away, and that distress is palpable.
And it's an easy thing for me to sit and say, you know, just lose the distress, or you know, think about something else, you know, imagine yourself on the beach, distract yourself away from it. But when people are faced with that chronic nature of the pain, that they're basically being told it's not going to go away, it's a little different. And that's when we're really, where this work that I do in mindfulness is really focused, is on staying present with what's actually here, because what's actually here is just the sensation, this pain in your back or your neck or wherever it might be. That's the only thing that actually exists in this present moment. Everything else is, you know, like you said, you know, well, if I knew it was going to end tomorrow, or if I didn't know, how distressed would that be? Well, we don't know what's going to happen in the future, but we do know what's here right now. Right now. So if we can let go of the attachment to what it's going to be tomorrow, or what it's going to be in a year, or what it was a year ago, or anything like that, and just be present with it, it becomes more manageable.
It's a perfect lead into the mindfulness concept completely. I think more people deal with stress and anxiety than have chronic bad pain. Mm-hmm. At least we're touched by that. You have been involved with I'm going to read this to make sure I get it, mindfulness-based stress reduction. Mm-hmm. I read a little bit about it in preparation for the show, and all of us, I've yet to ask anyone ever, do you have any stress in your life, and get the answer, no, ever. So everyone always seems to be dealing with some stress, and it seems like the one thing we don't learn in life is we learn how to do things that bring on stress, but we're not so good at getting rid of it. How does this whole thing work? If you could take a minute and explain it to me, or explain it to our audience so that it makes sense.
I think one very simple way of defining stress is that it's the struggle with what is. And if you think about that for a second, if you think about anything that stresses you, whether it's work stress, family stress, money, whatever it is, it's not about the actual thing, but the fact that the reality of it is something you don't want. So a better example would be if you're stuck in traffic and you're late, and you really need to get where you need to go, and if you're like me, you're leaning forward in your seat as if somehow that's going to get you there a little quicker, and then your back hurts and all of that sort of thing. So the stress in that situation is not really that you're late. It's that you're late and you don't want to be late. You're there in the car and you want to be at the place where you were. And so you're struggling with what is. And the reality is that you are in that car. So
and getting upset about it doesn't get you there faster.
Exactly.
Yet we all get upset.
And then we arrive and we're all stressed out and we're tense and we're irritable, and then it influences what happens there, and et cetera. So there's that sort of snowball effect. And so And if you look at anything, as I said, anything that stresses you out, you can boil it down to struggling with what is either having something that you don't want or wanting something that you don't have. Those are the two biggies. And everything comes down to that. And so mindfulness is just an ancient practice. That the word comes out of Buddhist traditions, but this is not really a Buddhist thing in essence. But the concept of mindfulness is very simply moment-to-moment, non-judgmental awareness. And it's bringing the focus of attention to what's actually here in this moment. And we do that by a variety of methods, primarily meditation. And meditation is really nothing more magical than that, than paying attention on purpose in the present moment.
I almost have a picture of someone sitting legs crossed, holding their hands out, meditation. Is that what you're referring to?
Some of that. We do teach people the very formal practice of sitting meditation, sitting cross-legged, but it's very little about the form and all about the intention. And so I have people in the groups that we run, this is an 8-week program, that have chronic pain that are there in wheelchairs. I've had people who really couldn't sit up during the whole time, all varieties of ability or disability. And it's all about focusing the attention. So what we know of meditation is this sort of sitting posture, but anything can be meditative. The time that we're spending together and talking can be meditative if my attention is fully present. And we know that much of the time we are not present. And sometimes more than others, but guaranteed both you and I, at various times in the times we've been talking, have mentally been someplace else other than here.
I haven't, but
Maybe it's just me.
While you were talking, though, I did think of something that I saw in a movie once a long time ago when they were talking about what made someone a good kisser, and they said, he gave you his full attention. And it never occurred to me that you could get that during a kiss, but maybe my wife knew that already. But it's rare. I even thought about my own children while you were talking. Do I ever give them my full attention? And how many things do we ever give our full attention to?
Exactly. As a matter of fact, perfect example. I went to a training 3 years ago, and at this beautiful retreat center, and about 2-3 days into it, I called home, and my son at the time was 3. Kids are the best teachers of this, really. And I picked up the phone, he picked up the phone, and I said, Ben, what are you doing? And there was a pause, and I said, well, I'm talking to you, Dad. I was like, aha, yeah, I'm all ready. What were you doing right before? What are you going to do right after this? And he was right there. So he's a great teacher for me, and that's really what that's about, is being present. And that was really the first appeal for me as a psychotherapist. As I started to learn about meditation and mindfulness, I could see the value of teaching it to other people, but first and foremost, I saw the value of it for myself in my daily life, being a parent, husband, all of those things, but also being a therapist, being in the office with a patient and being fully present, knowing how many times I've been in an office with somebody, physician, professor, whomever, who really wasn't there, other than physically, and knowing the value of that 100% presence.
It seems like this is beneficial not just for pain, but for life, as you're describing. Who couldn't use this?
That's my question all of the time, and people kid me because everyone who walks through my door, I'll say that mindfulness is my hammer, and everybody looks like a nail. It really is, and we often get off on tangents. People will say, well, does mindfulness or meditation work for rheumatoid arthritis or for hypertension?
All right,
or
I have a list of things I was going to, insomnia. I was going to ask you those things. So.
And the answer is yes. So we just
Okay,
cut right to the
off,
chase.
right.
I kind of look at it, it's really not an intervention. It's not like a pill or a surgery or anything else. It's really a way of being, a way of relating to the things in your life. And it's sort of like saying, is breathing good for living? It's just a way that you are. A mindful way of being is being fully present for a lot of things, and not just, it's really nice because it reduces stress, but it also helps you make clearer decisions, choose different options, react based upon the facts of the situation as opposed to your gut, which is sometimes good, sometimes not. even just being able...
You're not telling people to be cold and unemotional.
No, not at all. Those are all part of it, but you can think about times that you've made decisions spur of the moment without thinking, mindlessly, based on emotion that were probably not the best choices. It doesn't mean that emotion doesn't play a role, it's just that you make room for sort of all the options and you do it with some care rather than just without thinking. A great example is I've met several people with repetitive stress injury, carpal tunnel syndrome, and invariably these are people who have found a way to be distracted from their own bodies. And it seems as though there's this pattern that they do whatever they did, typing or scanning things at the grocery store or whatever. And these were people who kept going, pushed themselves. They felt something vaguely in their arms or wrists, and they just kept going because that's just their sort of style. What they were doing was distracting from the messages their body was telling them that something's not going on here. I mean, our body is an amazing, incredible organism that has its way of telling us what's going on. And if we don't listen, that's when we start to have health problems, and that's kind of where that awareness can actually head those off.
And I'm struck by what you're saying. You're not saying ignore all the pain. You're giving us a whole different way to look at the pain.
Yeah, it's actually the flip side of what most people think psychologists do with pain. You know, we teach about hypnosis and picture yourself on a sunny beach or whatever and sort of take your mind away from the pain. And I'm actually saying this is sort of radical and subversive in a way. I'm saying let's flip it around, let's look right at it, but just at what's here, just that sensation, and see it for what it is. I use the example about turning and looking to see what things are. That I was playing golf a few years ago, and as I often am, I was off in the bushes looking for my lost golf ball. Got out there, and it was in Florida, and I found the ball, and suddenly I thought, I don't know what kind of animals are out here, you know, alligators, I don't know what all they have out here, and I start to hear a little rustle in the bushes. And so I start turning towards the fairway, and I start stepping towards it, and it sounds like it's getting closer, and it's louder, and I have all these visions of bears and mountain lions, and I finally come out onto the fairway, and I'm out of breath, and my heart's racing, and I'm tense, and I'm sweating, and I have my golf ball, and I'm feeling safe, and I turn around, and out of the bushes comes a little bunny rabbit, just kind of hopping along there. And I thought, okay, you know, there was a creature in the bushes, and it was behind me, and it was coming towards me, and everything else was just a creation of my mind.
Right. There's a book that is one of my favorite books of all time. It's a science fiction book called Dune. And in it, they have a group of people who have this mantra where they talk about fear, and they say fear is the mind killer, and that they will turn the inner eye and face their fear. And when they look at it squarely, the fear will be gone and only they will remain. And that almost sounds like this mindfulness, and I bet you that the author had come across this sort of principle before and put it down in words that way, because it has always stayed with me as a way to face your fear, and often it's not what you thought it was.
Absolutely. A perfect example is in one of my mindfulness-based stress reduction classes this morning, a young lady who has fibromyalgia, which is a very painful muscle condition, and she was talking about having to do her homework, and I haven't said too much about the structure of the classes, but her homework was to use a guided CD to go through a sequence of yoga poses, very basic, simple yoga stretching. And she had a really bad week this week with her fibromyalgia, and a couple of times she went to do it and she just thought, oh, there's no way I can possibly do this, and just put the tape away and just didn't do it. And then she came to class this morning and we did yoga right at the beginning. She didn't feel much different than she had earlier in the week, but she felt the pull to do it. And after she was done, she was amazed. She felt like I had sort of helped her to face that fear, you know, by virtue of a little peer pressure or whatever all else, or because the doctor said so or whatever. But she did it, and she actually found that, wow, you know, I can go home tomorrow, and if I'm feeling like this, I can probably do it. And that was huge for her, and it took a lot of courage. And you know, I salute these people who have these kinds of conditions and are willing to get up and do odd things with their bodies and stretching out and sit for long periods of time. But it really, I mean, it was a turning point for her.
I think that's impressive. It's an 8-week course. Mm-hmm. You're obviously combining physical activity with the other things that go on. Mm-hmm. You meet once a day, once a week?
Once a week for 2.5 hours, and do these practices of meditation and yoga and other similar sorts of practices. And that's the easy part for the patients, and I tell them that up front, because we also ask of them that they spend 45 minutes a day practicing these things formally each day between the classes, which is a challenge for people to find that much time.
Isn't that a funny thing to say, though? Here they are dealing with some sort of important enough problem that it's ended up in your hands, and you're asking for them for less than an hour each day to commit to helping themselves when they're probably doing something that involves working or helping someone else or doing some other job, and yet people have trouble finding 45 minutes.
I had a very interesting experience that as I was describing this program to some UCSD physicians, primary care physicians, talking about the book Full Catastrophe Living by Jon Kabat-Zinn that we use as sort of a textbook, talking about the book, and these people were all sharing about their experiences, and they were all saying, oh yeah, I took transcendental meditation class once in college, and I did this, and I read Yoga for Dummies, and everybody had their own little experience that they had sort of tried and let go. And one of the physicians said, he says, this is what we get upset at our patients for doing, or starting on an exercise program or a smoking cessation program, and they do it for a little while and then they drop it. And here we are all saying that we've done the same thing. And he actually asked me to teach one of these programs for them, and that was actually my first class, was with physicians. So.
Oh, wow. I'm thinking that when we're done, I'm going to call you and arrange this for our department. We could all use it. Again, I can't figure out who can't. I read through, you had graciously loaned me that book, and I did not read the whole thing, but I did get through a large chunk of it. And they have instructions that can help you try and do it on your own, or you can get a CD to help you go through it. Is there a big difference between reading that book and going to one of the programs?
It's a hard to measure difference. It certainly is written in such a way that a person could guide themselves through it. What the people in the class tell me, and what I experience, is that, and this is where it sounds a little fuzzier than hard science, there is something about the energy in the room of people gathering together and doing this together. And I think there's maybe not that mystical auras or anything like that. It's more a matter of several people together with a variety of different conditions, but also traveling the same path and sort of exploring what they find when they slow down, pay attention to their breath, and are present for their lives. And there's something about that that sort of lifts each other up and spurs each other on and gives people a sense of connection to each other that is almost as valuable, I think, as learning the practice of meditation. These people are often, especially people with anxiety, depression, pain, cancer, just about anything you can name, they get to be very isolated. And so there is something about that contact.
There's something that must be going on that so many of us learn how to deal with these problems, I hate to say wrongly, for lack of a better term, but in a way that's not really productive, maybe counterproductive. As a parent, I have kids, you have kids. Our children seem to have this natural way of living in the moment, yet somewhere along the line they lose it. How could a parent help raise a healthy child mentally, to sort of to incorporate this into a parenting style, both from the parent's side and to help the child deal with the stresses that go on being in fourth grade, which are as real to those children as our stresses are to us?
By virtue of a parent practicing the mindfulness practice of staying focused and being aware of one's emotions and everything that comes up, in and of itself, it makes you a more attentive parent. And I think what happens there is that, at least from my experience, that when I'm with my son, I'm really with my son. And when he spills something, if it's something to get annoyed about or angry about, certainly, it would be appropriate. If I'm annoyed because I had a bad day at work or because the traffic was bad, I don't want it slopping over and carrying into that relationship. Or if I have some sort of issue from my childhood about spills, I don't want that spilling over either. I want it to be about he and I. And so I think that is a big part of it. I think you said it right. The kids have this natural ability, and I often feel guilty when I'm sort of like shoving him into the car because he has no concept of being late, really. He's 8. It doesn't really matter to him when he gets to school or whatever. So there's sort of a fine line of being fully present and trying to get a person ready for the world, and you can't be 100% mindful in this world and survive. So there is that sort of fine line.
We only have a few minutes left, and I would be remiss if I didn't ask you about something I came across in preparing for the show that I saw that you had been involved with because I'm an ophthalmologist. It was the eye movement desensitization reprocessing. I'm an ophthalmologist. I know pretty much nothing about eye movement desensitization reprocessing. I know a little, but I'd love to have you just touch on it for a minute.
I can only say a little. I'm certainly not qualified as an expert, although I have had some training. It's a technique, a therapeutic technique that was devised somewhat by accident by a psychologist who made the observation that as she was recalling a memory, a troubling memory, her name is Francine Shapiro, that her eyes were distracted by light through the trees or something, and her eyes were moving back and forth. And for whatever reason, she made this connection that bringing up this memory and having her eyes moving back and forth somehow took the edge off of this memory. And she's explored that in great depth, and there's been a whole ton of research and a lot of controversy about the idea of treating the effects of trauma or post-traumatic stress disorder with eye movement desensitization reprocessing. And there are lots of explanations about why people think this works, and nobody really understands it completely, but there is a lot of mounting evidence that this is a treatment that works quite well in resolving traumatic memories. And actually a number of our clinicians in our outpatient psychiatry have been trained in this method and are using it quite regularly in the last year or so.
All right, now I have homework. I now have something else I'd like to do. We have about a minute left. If you ran the world, what would you like to see happen? Short term, long term, with mindfulness, both locally, nationally, in the way our society works, et cetera.
I think, as you said, there isn't anybody who can't benefit from being more aware of their life and each moment in it. I like the fact that I'm very much welcomed by my medical colleagues in particular, in helping to work with their difficult patients. And the more that mindfulness can be a part of people's lifestyle, and I think even beyond treating in medicine, we're treating illness and those sorts of things, but as people begin to see the value of it just in their daily life with their daily run-of-the-mill amount of stress, there's far-reaching implications of a world that is more mindful, including things grand like world peace and things of that nature, but, starting small.
No, I wanted you to reach big. That's great. Well, thank you so much for joining us and talking to us about this. I don't think most people spend enough time thinking about these issues, and if they've sat and listened to you for a few minutes, that's a grand start, at the very least.
I appreciate the opportunity.
We've been talking with Dr. Stephen Hickman about mindfulness, and once again, knowledge is power. The more you know about how your body works, the more you know how about your health works, the better off you are. I'm Dr. David Granite, and we'll look forward to seeing you again next time right here on Health Matters.